Hi, you're watching FRCD on CAN TV. Family Resource Center on Disabilities is the Region 1 Parent Training and Information Center of Illinois. You can reach us at 312-939-3513. Email us at info@frcd.org and visit our website at www.frcd.org. We encourage you to follow us on Twitter at FRCDPTI and subscribe to our YouTube page at FRCD1231. And we also invite you to like us on Facebook. Family Resource Center on Disabilities is not a law firm or a legal service agency. Family Resource Center on Disabilities will not provide any type of services that may be construed as practicing law, including but not limited to giving legal advice, drafting legal documents, or representing families in any type of legal proceedings. Hi, my name is Paula Wills, and I'm happy to welcome you to another episode of FRCD on CAN TV, where we focus on special education, parent advocacy, and resources for families of children with disabilities. And today I am happy to introduce Tracy Schultz from the Epilepsy Foundation of Greater Chicago to our show today. Hi, Tracy. How are you?
I'm good, Paula. How are you?
I am good. Almost forgot to answer that question there. So could you tell us about the Epilepsy Foundation for Greater Chicago and how it helps families?
For sure. So the mission of the foundation here in Chicago is to lead the fight to stop seizures and to find a cure and overcome challenges that people with epilepsy face on a daily basis. And our services are wide-ranging. Here in the Chicago office, we offer all of our services free of charge to the families, and they range from counseling, advocacy, and educational services to more specific programming for different subsets of populations. So for example, and I think Paula's pulling it up there, for parents specifically, we have support groups. We have educational advocacy services, which basically means that we can have a counselor or a case manager come on out to your child's school to advocate on your child's behalf for a 504 or an IEP meeting. We also have school-based educational programs, which is my area of expertise in the office. So we provide on-site school training programs for staff, for school nurses, and also for students in grades K through 12 and beyond. So we can do age-appropriate training on seizure recognition and first aid for students, and then again, as well as staff. We also have, if you saw the flashing through there, our Parent Link program. And our Parent Link program focuses on topics that are important to parents. So things that they want more information about. So for example, our current series that's running, we did series on depression and epilepsy. We did a session on sibling issues and epilepsy. We also will be talking about 504 and IEP planning. And we talked about transition planning. So getting your child into high school and then beyond high school, what will happen. We have our Consumer Conference, which is an annual event that we host free of charge again to families, people with epilepsy. And it's an all-day educational session on different topics that pertain to epilepsy, like treatment, anxiety, depression, medical services, insurance questions, just space time with a doctor so you can sit and ask questions that you have that you may have not asked your treating physician. And so there's a lot of programs available for the parents to take advantage of, but then we also have programs for the kids that benefit the parents. So first and foremost is our Camp Blackhawk program. So it's a week-long summer camp experience. So it's a chance for a child with epilepsy to basically go away to summer camp. They spend, 5 nights out of the house, sleeping in a cabin with other kids who have epilepsy, and they go swimming, they play sports, they go play archery, they do a zip line, all kinds of activities. So things that you would normally do at an overnight summer camp that, is in a medically safe environment. So we have nursing on staff 24/7, and the counselors work with them based on a ratio of care no more than 3 campers to every 1 counselor. So it's a chance for the parents to have a week away to themselves to do something, or even have a week to spend with their other children that they may not get to concentrate on all the time. And then we have other programs like art therapy, writing therapy. We have our teen group program. So there's a lot to take advantage of in the office. And so our website is the best place to access that information at www.epilepsychicago.org.
So that's phenomenal. But could you explain to us, for some of us who don't know what epilepsy is, people who don't know what epilepsy is, what is epilepsy?
besides a tongue twister. It is a neurologic condition, basically, that causes a person to have seizures over and over again. And it's important to note that when we talk about seizure activity in and of itself originates in the person's brain, which a lot of people don't know. Most of the time when you hear the word seizure, you think of the physical symptoms, shaking or convulsions or a loss of consciousness. But it's important to note that the seizures themselves are happening in the person's brain. So it's an overload or a power surge of electrical activity. And when this overload or this power surge occurs, that's what then produces these possible physical symptoms that the person may see. So the area of the brain impacted by the power surge, by the seizure, will determine the symptoms the person experiences.
So could you explain, I guess, so let's say my child is in school and they experience their first epilepsy seizure, or maybe I didn't know my child had epilepsy, or they just experienced a seizure. What are some of the first steps I should take as a parent?
So when it comes to a first seizure episode, I think it's really important to first and foremost, well, depending on what type of seizure they had. So if it's a convulsive seizure, a tonic-clonic seizure, where they've lost consciousness, they're shaking all over, that is definitely an immediate trip to the ER. Okay, so if any child ever has a convulsive seizure, always important to get to the ER to see what happened. Because I will tell you, first-time seizures sometimes are symptomatic. So 1 out of every 10 people will have a single, usually convulsive seizure episode at some point in their lifetime. And so if that happens, the doctors need to figure out what caused that seizure to occur, because most of those seizures are what we call symptomatic. So it was caused by a fever or a head trauma or some sort of infection or another neurologic issue like a stroke or a tumor. So important to get that checked out for a first-time seizure episode. But that's for convulsive seizures. Now, we have some students that we work with that have what we call non-convulsive seizure episodes. So they're seizures that are not what we would think of as your typical everyday seizure. It could be a staring spell. It could be a muscle spasm. It could be a sudden fall. Or sometimes a symptom where this child, looks awake, but they're not really aware of their surroundings. They're not responding, and they're performing some sort of repetitive task. So they might be picking at their clothing or touching their face or smacking their lips repetitively or just staring into space and completely glazed over and unresponsive. And so these are non-convulsive episodes. And a lot of times when we have parents going to seek out first treatment for an episode like this, it's usually because school staff has reported to them that they're noticing this odd behavior at school, that something's happening with the child. They're not quite sure what it is, but they've seen it more than once. It doesn't feel right. You might want to take them to the doctor to get them checked out. And so in a non-convulsive episode where you may suspect something's happening, and you just want to see what that something is, you can go to your primary care physician. So you can go to your pediatrician, your internist, your family practice doctor, and just, describe what's happening and see what they say. They may make a referral, or you can just jump straight ahead to a doctor who's a pediatric neurologist. So these are doctors who specialize on the brain and specialize in children's brains. And so they may run you through a gamut of tests. You can even skip the pediatric neurologist and go straight to a specialty doctor called a pediatric epileptologist. So these are neurologists that specialize specifically in epilepsy. So it just depends on what's happening, how severe it is. Most doctors, they'll hit the pediatric neurologist first and figure out what's going on. And in a case like that, the doctor will usually do a medical history. So they're going to do a full workup. They're going to ask you lots of questions about what happened. It's helpful, if school gave you kind of a description of symptoms, to bring that with, because the doctor will say, some questions could be, could the episode have been provoked by something? Before it happened, did they not get a good night's sleep? Were they using alcohol or other drugs before it happened? Or was something else a factor? Were they sick? Did they have a fever? They'll ask if there was a warning sign. Did they get dizzy, or did they kind of glaze over before it happened? Or did they, say they had some sort of weird pain or see something funny? They'll ask how long the episode lasted. They'll ask what happened after the episode. So when they came back to, or they regained awareness or consciousness, were they out of it? Were they tired? Were they disoriented and confused after the fact? So the doctor is going to, ask a lot of questions about the incident itself. And then they'll probably do a thorough examination. He'll probably order some tests. He'll do a blood test. He might do a CT or an MRI. And then they might do what's called an EEG. And an EEG is a specialty test. kind of used to diagnose seizures and epilepsy, and it stands for electroencephalogram. It's a very...
That sounds scary.
I prefer to use EEG as opposed
yes, I
to
like
the real
EEG
word.
better.
So basically, it's a brainwave test.
Okay.
So they're going to attach electrodes to the child's head, and the doctor's going to maybe try to trigger a seizure episode. So they might throw some stimuli at them, flash lights in their face, have them hyperventilate. In some cases, they'll have you bring them in, maybe deprived of sleep ahead of time.
Okay.
And they're going to look for changes in the brain's electrical patterns. So they're going to look for what they call spikes and waves, and that would indicate seizure activity in the absence of physical symptoms. And so after that, you know, the gamut of tests is run. The doctors may have a conclusive diagnosis that they'll make, or some of the tests may come back normal. And so it doesn't necessarily mean they're not having seizures. It just means that if they have seizures, they didn't have one while they were hooked up to the EEG.
So this could be an ongoing process.
It could be an ongoing process. So normally what I tell parents is if they've gone for an EEG and they've done the whole gamut of tests, and the doctors, you know, and maybe they're just seeing their pediatrician or they're just seeing a general neurologist, but the weird behavior is still happening. They're still noticing it. They're cued into it now and they see it happening. That I always recommend, or I ask, how long was the initial EEG? If they tell me 20 minutes, I normally say that probably wasn't long enough.
Okay.
And they might need to go in for a longer period of time. And so that's when it might help to go to an epilepsy center to see an epileptologist. And here in Chicago, we're really lucky. We have access to many experts in the field of epilepsy. And so if they make it to any of the major children's medical centers, UIC, Comer, Lurie, that they will have access to an epileptologist at any of those centers.
You know, I don't want to say you bring up one extra interesting point, but you bring up a lot of interesting points. Most of us are familiar with the convulsion seizures, where, you know, we see the person, you know, react, maybe fall, and we've seen that. We've seen it on television. The non-convulsive ones, that's the ones we're not familiar with. So it brings me to another concern or point is, okay, so my child's in school, and let's say they are having one of the, I don't want to call it one of the non-typical seizures. When you're trying to get an IEP or you're working on your child's IEP, you know, acquiring accommodations and modifications, what are some of the common modifications or accommodations you might see in an IEP or a 504 plan? You know, and does that make sense?
It does make sense. It does make sense. So when it comes to providing supports for a child who has epilepsy, the process can be difficult because no two brains are exactly the same.
Right.
Everybody's brain is wired up a little bit differently. And so it really depends on what type of seizure they're having, how long the seizures have been happening for, how old were they when the seizures onset, and really what part of their brain is impacted when the seizures occur. And all of these factors come into play when it comes down to supports. I will tell you that, you know, the need for supports ranges from, you know, mild to pretty severe. And again, it depends on the seizure frequency and severity and what part of the brain is impacted. So this is a tough, well, I'm going to give you the long version of this answer.
It's okay. I actually want to hear the long version.
Okay. So when we look at epilepsy only, so your child's been diagnosed with epilepsy and you're looking at possible impacts, I will first off tell you that most kids with epilepsy do have IQs within normal ranges. Okay. A majority of kids with epilepsy will have no impacts. I would say 70 to 75% of kids, educationally, they'll be okay. All right. No cognitive impairments, no delays, nothing major happening with their medication in response to that. And so they can usually be fine academically. But other kids, again, it depends on part of the brain impacted and where the seizures are emanating from. And so when we look at seizures specifically, we know even without physical symptoms, so they have a staring spell or a funny feeling or an odd smell or taste, that those seizures can still have impacts on their overall learning. And on top of that, medication can make all of those issues worse. So all the medications they use to treat epilepsy have side effects. And so it really depends on tolerability and how many medications your child's taking to get their seizures under control. So that's going to be a factor in their learning and their academic success. So Seizures by themselves, we know they cause short-term memory issues. We know that after a seizure, coursework may need to be retaught. So one single seizure episode can put them behind. They could have lost their whole morning or part of their school day, and that information needs to be repeated. And we also know that kids with epilepsy commonly have issues with attention, with concentration, and with memory. And again, that's just across the board. They can have these problems. But then when we focus on where the seizures are coming from. So, for example, we'll talk about a couple of different parts of the brain that can be impacted. Your temporal lobes. Okay, so these are the lobes right here. And your temporal lobes are basically responsible for learning and memory. So the ability to retain information and then recall it later. And so when you're having seizures in this part of your brain, it's impacting the part of your brain that receives and stores information. So the child may be able to store information, but it may be stored in a very disorganized way. So when they go to retrieve it later, it's also disorganized. Okay, so they're able to hold on to things, but it's very muddled, very complicated, very confused. Also, seizures may be happening on the left side of a person's brain. So we know most people house their language on their left side of their brain. So if you're having seizures on the side of your brain that controls your language, you may have language issues. And it's not necessarily inability to speak or put sentences together, but it could just be word retrieval, that you have the word and you can't get it out. So those communication lines to get the word from A to B so you can say the word are lost, or the word retrieval in and of itself is gone. So you look at something and you can say, okay, this is a book. I know in my head this is a book, but I can't find that word to recognize what this is. And then other kids may have seizures happening in their frontal lobes. So your frontal lobes are right here behind your forehead. And your frontal lobes are really basically responsible for executive functioning. So kids who have seizures in their frontal lobes may have problems with organizing their thoughts and their actions. They may have problems with attention. So they're with you and then they kind of drift off and they can't focus on one specific item or action. They may also experience personality changes, okay, or behavior changes, or they may lose their ability to control their behaviors. So they might start acting out or acting inappropriately, and they know that they're not supposed to do that, but they have no self-control over that activity. So there are lots of things to kind of take into account when working with a student who has epilepsy. And so first and foremost, you need to really tailor the accommodations and the supports to the specific student. And to do that, basic starting with would be an evaluation, usually done by a school psychologist. And you want them to do a comprehensive evaluation to look at their cognitive and academic strengths and weaknesses. Okay, so that would be a basic testing that they can do in school, pretty easy peasy. If you want to take it a step further, there are special doctors out there called neuropsychologists. And a neuropsychologist can do a more intensive evaluation that really assesses language, memory, visual processing, attention, and then executive function. So that would be a more in-depth test than what a school psychologist could do. And once they get the results of that test, it's really important for the teachers to try and match their curriculum and instruction to address the needs of the student and their skill base. So that would be a basic accommodation to make. And then if those accommodations eventually fall through or they're not as supportive for the student, then maybe beginning the process of a 504 or an IEP might be necessary. And some basic accommodations we have just as examples for kids who have epilepsy, accommodations that address their epilepsy specifically. Parents ask for the teachers to document seizure activity. So if they have a seizure at school, and they request that you document that and then share that information at the end of the day or the end of the week, whatever is necessary. The parents will ask that the school staff be trained in seizure recognition and first aid, so they know how to address seizure activity should it occur. And that's something that we can provide through the Epilepsy Foundation free of charge to the school. Arrange a buddy system. So if the child is going to the restroom or walking up and down the stairs or transitioning from classroom to classroom, important to have somebody with them when they're in the hallway. Depending on their impacts, they might need an alternate recess time. So maybe if a trigger for your child is overheating or overexertion, maybe as it gets hot out, they can't go outside for recess. Maybe they need a cool place indoors, so an alternate option for recess. Same goes for PE. And then adapting activities, so climbing, swimming, if they have restrictions on their behavior. Also, some things we don't think about sometimes. So in bathrooms at schools, I spend a lot of time in schools doing trainings, and the stall doors. So some open out, some open in. And so for a student who has epilepsy, they may request that doors open out, because if they had a seizure and they were in a bathroom stall or they were in a room with a door, they would need to be able to open the door out, because if the student fell in the bathroom and they were leaning against the door,
no one could get to them.
No one could get to them. So
that is something I never would think about.
Yeah, simple little things. And then too, we have students who maybe they don't use the restroom the other kids use. They may use the restroom in the nurse's office, and so they're using that restroom, but they're not locking the door. Right. So just in case anything happens while they're in there, someone can access them. And then when we look at accommodations for learning, accommodations for memory deficits, and these are pretty basic, but, if they're having issues with memory and with retrieval, a lot of repetition. So a lot of just repeating information, repeating that material so it's really ingrained. Redirection and cueing. So if you feel like they're struggling or they know what's coming next, but they need a little bit of a push, giving that cue. Always extra time. So if they need extra time on tests or extra time to complete assignments. And then when it comes to performance testing, we really go for no timing. So for our students who maybe have some memory deficits, they need a lot of extra time to complete those tasks. And then breaking things down into simpler steps. So if you have, a word problem, don't give them the whole word problem at once. Maybe give them a sentence at a time so they can work their way through it. And then language deficits, extended time for verbal responses. So if you call on them in class, which a lot of our kids, if they do have, a language deficit, a word retrieval issue, they feel very self-conscious about that. They are terrified of the teacher calling on them in class. And so it's just allowing that extra time for them to respond and not putting the pressure on them to respond quickly. Or sometimes it's maybe you don't put them on the spot and call on them in class. Slowing the pace for verbal direction. So if you're giving them instruction verbally, to really take it down step by step, or sometimes writing down the instructions. So if you're doing, an in-class instruction, you're giving them directions to an assignment you want them to complete, make sure you have it written down for the students so you can just give it to them so they can follow along as you're going through the steps. Or pairing them with a classmate so they can verify things. That always helps. Again, that buddy system. Or giving them a note taker in class. So
and also you educate the other students in class about epilepsy. And
yes. So it'd be a good time to, educate those buddies to help out.
Inclusion. So
yeah, it's very good. So those are just some basic accommodations that could be given to a student who has epilepsy. But I always say, if you have a list of accommodations that's more than a page long for one student, it may be time to evaluate for that IEP because they may need more solid supports.
So, wow. Ooh, that's
You let me talk all day, I will, Paula.
No, I mean, it's very helpful. I'm like, just things I never thought about, particularly the bathroom situation. I never thought about that, or any situation where you might be by yourself. I never thought about the doors, and I'm sure a lot of you haven't either. But no, that is great information. But I also want to address another situation, like peers, and let's say out of school situation, because you can't hand everybody a list, So let's say you're dealing with family members or caregivers, or just kind of explaining epilepsy, especially if it's the type of epilepsy that is non-convulsive.
So we have done training programs for caregivers before. So I've had situations where it's a family and there are multiple people helping to care for the child, extended family, or they have in-home respite or other caretakers, babysitters. And so we've gotten together at local community sites and they'll invite everyone to one place and we'll come in and do a seizure recognition and first aid training. We also have a variety of materials available in our office. So we can always put together a packet of information to send out to you on different types of seizures and how to properly respond. There's videos online, so on our YouTube channel at Epilepsy Chicago, or even on the National Office's YouTube channel.
And you know what? I want to pull up information on how you can reach the Epilepsy Foundation overhead. It is the Epilepsy Foundation, and if you if you have additional questions about what you've heard today, or as you said, the packets and videos, you can They are located at 17 North State Street, Suite 650, Chicago, Illinois 60602. You can reach them at 312-939-8622 or their toll-free number 1-800-273-6027. We are actually literally down to our last 2 seconds.
Wow. That did go fast.
Yes, it did. But I'm so happy that you came on this show and shared all this great information. And I want to thank you for being a guest, Tracy.
Thank you.
And again, my name is Paula Wills, and thank you for tuning in to FRCD on CAN TV. You have a great week.